And for the next 2.5 hours, I'm going to go through these next 400 slides and go through the details of this. But anyway, we value what we eat and who we love. I'm going to start with a little story. Once upon a time, back in 1997, a dream came true. When I was in ninth grade, a classmate of mine, Bill Kessler, said, "I want to be a doctor because doctors make $90,000. And I looked at him and I thought, I want to make $90,000. I want to be a doctor too. And so from ninth grade on, my mind was made up. And so throughout the years of going through school, et cetera, and in 1997, I finished my cardiology EP fellowship. And after 7 years of training in school, after medical school, I opened my practice. And so a dream came true. And I started seeing lots of patients. I had practice privileges all throughout Houston. I drove all over town. I had emergency room privileges. I saw patients in the hospital, in the office, and my practice grew rapidly. There's one particular patient that I recall was a 69-year-old lady who's referred to me for dizziness. And then when taking a history, I felt it was a neurological problem. I referred her to a neurologist, and we evaluated it together and found that she had a brain tumor. It was thought to be benign and operable. However, she had extensive history of medical problems. She had diabetes. She was having some chest discomfort, had a history of hypertension. She was overweight and had carpal tunnel syndrome. So she needed a cardiac workup before she underwent surgery. So essentially, we reviewed her medications. She had a stress test, which is abnormal. She had a heart cath and underwent angioplasty and stent placement with success. After recovering from that, she underwent the surgery, and tumor resection was successful. And so there we were, the largest medical center in the world. We were feeling great about ourselves. We had defeated cancer, if you will, and heart disease at the same time. But there's more about this story. What I will tell you is that in the course of my practice, I started noticing a significant trend in the way we practice medicine. There was a standard way of seeing patients. We start them on medications. If they had symptoms, and we have to add more medications frequently because when we control a problem today, it would only persist, and so we have to add medications. Oftentimes, you'd have to consider surgeries and other procedures and so on and so forth. And so I noticed over time, my patients were getting sicker, and we continued to apply this. So I started to realize that we had a certain standard of care in medicine. And so what is that standard of care, you may ask? Well, I'm glad you asked. Let's consider this hypothetical story with Jim. Jim gets a vice grip stuck on his thumb. He's working in his garage, and it gets stuck, and his thumb gets sore, and it gets swollen, and he goes and sees his doctor, and the doctor says, well, Jim, what brings you here today? He says, well, I have a sore right thumb. It's been sore for 2 weeks since I've gotten the vice grip stuck, and it's tender and painful. He takes a medical history. You have any medical family members with them problems? He says no. Any other issues? And so he examines the body. His lungs clear, his heart's normal, face, head, neck, but the thumb is tender and swollen. So after a comprehensive history and physical, the doctor pulls out his prescription pad, writes for 200 milligrams of Motrin every 8 hours, writes for Tylenol number 3 every 4 hours as needed, and has Jim follow up in 2 weeks. So Jim walks out with the vice grip stuck on the thumb, prescriptions in hand, and he comes back 2 weeks later and says, well, how are you doing, Jim? Well, I had some relief. However, the pain and tenderness came back, and it's now even more swollen. And the doctor examines him and confirms these findings and makes adjustments in his therapy. He increased the Motrin to 400 milligrams every 8 hours, changed the Tylenol to number 4, that's 60 milligrams of codeine instead of 30. And he starts him on lactulose because Jim's has a little constipation, okay, probably due to the codeine 30 milligrams. He checks some blood tests for the kidney and liver function. And of course, this is an astute physician, right? Because Tylenol can have adverse effects on the liver, and the NSAID, the Motrin, can have adverse effects on the kidney. So you have to monitor these things. So this is actually great medicine. So it's a board-certified internist. So he has him follow up in 2 weeks. Jim comes back on visit 3. He has partial pain relief for 2 weeks. However, Pain comes back, swelling's overall still there. Constipation is worse despite the lactulose. Abnormal kidney and liver function are found on the blood tests. That's not good. So his doctor, being an astute physician, adds indomethacin to the Motrin, continues the Tylenol 4, but because of the abnormal blood test, he refers him for a kidney and GI workup by specialists. So he's having follow up in 6 weeks. And so Jim goes out with his new prescriptions and his referrals. However, before he gets to see the specialist, something bad happens. One night, he starts getting fever and chills. He's rushed to the local hospital. He's found to have a gangrenous thumb. That's not good. He's admitted to the hospital. The thumb is so bad it has to be amputated. He goes into kidney failure because of the infection in the NSAIDs, and he ends up being discharged from the acute care hospital on dialysis to an LTAC hospital where he stays for 3 months. But the good news is the insurance covers everything. And there was no application of pre-existing condition clauses. How about that? And Jim leaves and he's elated. He's got 25 new prescription medications, and he's marveling over the wonders of modern medicine and the power of Obamacare. So this is our wonderful state-of-the-art form of medicine. Now, why are you guys laughing at this? This is a board-certified physician, and he's practicing standard medicine. Y'all have a better treatment for Jim? Anybody? Wise guys? I hear someone saying something. Remove the vise grip. Okay. That's not a bad suggestion. Wish we'd have thought of that earlier. But you know, this is a ridiculous scenario that I share with you. And I've shared this in talks before, and I get the same laughter, same weird facial expressions. But despite how ridiculous this scenario is, this is the way we practice medicine. That's the scary part about it. The scary part is that when we see patients come in, they come in with a proverbial vice grip on the thumb. That proverbial vice grip is the poor lifestyle that they live, more specifically the bad food that they eat. But we start them on medication after medication after medication. They get procedure after procedure after procedure. And what happens is that they get sicker from the treatment as well as their primary illness. But we fail to remove the vice grip on the thumb. In fact, in Jim's scenario, the only reason his vice grip was removed because the thumb had to be amputated. And that scenario is not too far from the truth either. And so our standard way of practicing medicine is one that's deleterious and more harmful than it is beneficial, not to mention it's very expensive. Now, what about that patient that we talked about earlier? The one that I saw early in my career. Well, she really wasn't out of the woods as we thought she was. You know, subsequent to the successful tumor removal, she developed meningitis. Subsequently, hydrocephalus. She had to have a brain shunt placed. She eventually had bleeding, which led to seizures, more brain function disorder. She had to have a VP shunt placed. That resulted in more problems. She had a prolonged hospitalization. I remember going in one night, emergently having to stick a needle in her chest, drawing blood from around, do the cardiac tamponade. We worked tirelessly for about a year and 10 months. Unfortunately, she died of liver failure. Despite all the effort we had put into it, all the technology, all the power and might of the largest medical center in the world with all the resources in the world, we fought long and hard for this patient and we couldn't get her back. When I reviewed her chart, it was the medications that led to the liver failure. And to a certain extent, the standard American diet that she followed, because she was a diabetic, she had heart disease. The foods not only contribute to her primary disease, but also contribute to liver dysfunction, as did the medications we gave her, including the anti-seizure medications. But the most significant characteristic about this patient was that she was my mother. Now, when I was a little kid, Mom taught me how to tell time, taught me how to spell, read, etc. And she used to tell me, son, I'm going to be your mother till the day I die. And interestingly enough, I didn't know how profound that statement would be, because it was on her deathbed that she taught me the most valuable lesson I'll ever learn in medicine. And that is the fact that the food that we choose can have a major, major impact on our life. It was at this point in my career that I started to turn the needle, and I started to look at plant-based nutrition more specifically, because when I started reading and started looking for other ways, because the way we practice medicine did not work, I found out that this is the most important thing, is what you eat and what you don't eat that leads to the best health. So my mother didn't die in vain. It's all good, because we learn new lessons. And so the heart of the matter is the choices we make. You know, we make choices about career, what business we're going to go into. We talk about school. I have high school students making career choices, college choices, etc. However, every day we make very, very important choices that will impact our lives and our families' lives. What am I going to have for breakfast? What am I going to have for lunch? What am I going to have for dinner? Those choices that we make have a big impact, not only on ourselves, but on our loved ones. So the food we choose has an effect on the ones we love. The next thing is, what's the heart of the matter for medicine? Medicine is simple. The body will heal itself in a setting of proper nutrition. We as doctors and healthcare professionals need to learn that. We need to learn that the optimal food is plant-based food in addition to water and sunshine. And we need to learn that the optimal medicine, the optimal health is going to be by means of that path. Lastly, I want us to understand what is going to be our legacy. Realize that families pass on disease more effectively through recipes than through genes. Let's think about our legacy, and let's pass on a healthy legacy for our future. Thank you very much.